All right, we're back, and we have a very different session than we've ever done before. In our lab at Cincinnati Children's Hospital, we are very focused on paying attention to what are the new technologies that are becoming disruptive. What do we pay attention to? How do we know what to pay attention to? And so Tombash and Ramy Shaaban, who are part of our team, work together to try to do an environmental scan of things that we think are coming soon, things that will be disrupting the field of healthcare and especially pediatric surgery. So with that, I'm going to introduce Tombash.
Just skip the next slide.
Oh, here you go.
Fellow at Cincinnati Children's Hospital Medical Center.
And I am Ramy Shaaban, an assistant professor of instructional technology and learning sciences.
First and foremost, I'd like to say that we're glad to be here presenting you the latest innovations that we believe are transforming healthcare. We separated them into two categories: innovations for medical, surgical, educational purposes, or clinical purposes. So we have our first poll here. We have pre-recorded 4 different videos, and we're going to discuss our poll questions in the upcoming videos. But I just wanted to ask, what do you think is the best way to teach trainees about medical topics? Textbooks or lectures, videos or podcasts, escape rooms, virtual reality, AI, or hands-on models to practice on, which we've been doing for the last decades.
Let me even go. Does anyone here use anything other than the top one? Does anyone use videos, podcasts, escape rooms, virtual reality, or hands-on models to teach? Which of those do you use? Yell it out now. Do you use any of those? What? What do you use? Hands-on models, box trainers, anything else? Videos? Okay. All right. All right,
Ellen, Paul?
Oh, it's still adjusting, but videos, podcasts, and hands-on models are the top.
Yeah.
I mean, that's something.
Obviously, we're biased. We believe that media is becoming critical to learning now, but let's roll the video.
If you are ready, let's get started with innovations for educational purposes. Medical education has changed focus to a more learner-centered model, placing learners at the center of innovation in training and over the past 2 decades. About today's first topic, I believe everyone knows what an escape room is. An escape room is a time-bound, immersive adventure experience.
It is basically a room with hidden clues and keys where you're trying to get yourself out of before the time ends. And activities typically include a variety of sequential puzzles or can be adapted into an escape box challenge where participants work to successfully unlock a box.
So it should be no surprise when I tell you that escape room needs teamwork. Since communication, teamwork, and resilience all require active practice by healthcare teams, escape rooms or escape box exercises can help healthcare teams to develop and enhance those skills, as well as reinforce medical knowledge.
Medical escape rooms have been utilized to teach and reinforce a variety of topics, including discussing cancer diagnosis, cardiovascular physiology, and fluids and electrolytes.
Despite appearing to be a superficial form of entertainment, escape room can be grounded in a sound educational theory, and when used effectively, acts as a low-cost, high-impact resource for a variety of learners.
There are a lot of institutions adopting medical escape rooms to teach their residents, nursing staff, and other trainees how to recognize and respond to certain medical conditions, like preeclampsia, sepsis, and patient safety.
Texas Children's Hospital, the Woodlands, the University of Kansas Health System, Penn Presbyterian Medical Center, University of Minnesota are a couple of examples that have built a medical escape room to improve education among trainees.
Luckily, there are a lot of publications from different institutions out there that publish their experience and how to guide. If you want to build a medical escape room, you can use this paper as a reference, which was published a couple months ago in April 2022 in the Medical Teacher Journal by Casey Davis and her colleagues. Yes.
All right, so I'm going to tell you my thoughts. So I can't tell if this is hokey or if this is meaningful. I also can't tell the difference if this is another way of just saying running through simulation triages. I don't know. Do you know how escape rooms are different than just running through a medical simulation?
I think it's that based on the same concept, but we're going to talk about gamification next, which escape rooms kind of make it like a game. So you're trying to compete with another team to have a better results.
Okay.
And you can compete with your previous scores too.
And so Ramy Shaaban, who is an ENT who got a PhD in instructional technology, got his thesis in esports. And he believes that adding competition to learning actually drastically improves your retention. So you'll be seeing more competitive initiatives coming soon. Mark?
Yeah, I was just going to say, if you check your phone, I just texted you and said, let's do this. This looks like so much fun.
Awesome.
I mean, and
Okay.
again, I think the gamification of education, it can be, pun intended, a game changer.
Yeah. And
You're already
Ramy's going to
changing
love you
practice.
that you just said that, because Ramy yells at us every day, gamification is the answer, gamification is the answer. And we don't do it much in healthcare. Dan and I always joke that a lot of the stuff that Em is going to show, we sometimes think is a little on the early side, so it's kind of fun and gamey, but not really meaningful. AR, VR is one of those things. I think it's not quite there yet, except for I did see something cool last week. But I agree with you. Let's work on this.
See, we're already changing the practice.
You're already changing my practice. That's right.
So the second poll question is, what is the future of medicine? Telementoring, home monitoring, virtual hospitals, telemedicine, and staff robots that carry blood samples or maybe sometimes patients in different hospitals in Southeast Asia.
Or all of the above.
Or all of the above.
Telementoring. Okay, so I think what's the most impactful? What do you think of these? If we look back 7 years from now, we circle as the one that made the biggest impact in healthcare. Telementoring, home monitoring, virtual hospitals, telemedicine, and staff robots. And I will say, when I say telemedicine, meaning it's much different in the future than it is today.
Oh, that's the next video. Basically wearing a VR headset, and it's telemedicine, but you're in the virtual world.
So, but before we play this, I'm going to just tell you, this is, I'm sensing some of you think this concept is kind of cool. We need help. We feel like we're on an island trying to environmentally scan what's out there. We're trying to create a cohort of people that work together and say, hey, this was just implemented into our hospital. You need to know about this. This is something, because we don't talk. So anyone that's interested, we meet every week. We would love to. All right, send me an email or message. All right. The poll, which
It's pretty divided.
all over the place. All right, can you roll the video?
Don't worry, there is no wrong choice here. All of these options are possible, and we believe sooner or later all of these technologies will be implemented into healthcare to make patient care better and more effective. Now moving to our next topic, which is based on virtual reality. As definition, virtual reality is a simulated 3D environment that allows users to explore and interact with virtual surroundings in a way that looks like reality.
The other term we need to know is metaverse, which is an integrated network of 3D virtual worlds. These worlds are accessed through a virtual reality headset, and users navigate in metaverse using their eye movements, feedback controllers, and voice commands.
Tombash Group from Dubai, UAE, is the first to build a virtual hospital on a metaverse to interact with patients and to improve patient experience. Full-fledged virtual hospital will provide patients with an immersive experience in healthcare, from the patient experience center to complete walkthrough of the hospital and service.
With teleconsultation, just by using their virtual headsets, avatars will be able to visit multiple doctors working in a virtual clinic or get a second opinion from various healthcare professionals. Also, a virtual hospital will offer first aid and preventative health programs using AR, VR, and artificial intelligence softwares to educate patients and suggest treatment plans.
Of course, VR applications in healthcare are not just limited to virtual hospitals. VR can be used to ease anxiety before procedures or during imaging or help pain post-operative. Even in some cases, VR can be used to reduce the need for sedation or general anesthesia during the minor surgical procedure.
In 2018, Lucille Packard Children's Hospital, Stanford, as one of the first institutions to pilot VR capabilities in pediatric clinical settings, has expanded its VR program to help young patients in more places beyond the hospital. With over 150 use cases per month, Stanford Medicine Children's Health is home to one of the nation's largest VR programs.
Their Childhood Anxiety Reduction through Innovation and Technology program, or CHARIOT in short, aims to take existing technologies and create new ones to address unique needs of individual patients.
A team of physicians, engineers, researchers, and child life professionals is currently piloting virtual reality experiences, new tablet-based apps, and interactive bedside projector-based games. And for the next part, I want to introduce a concept called gamification.
Gamification is the application of typical elements of game playing to other areas of activities, especially with tasks that are not enjoyable, such as in-depth safety training or compliance training to encourage engagement with a product or service. Lately, we see more and more gamification applications in healthcare.
In this prospective, randomized and controlled trial study from Seoul National University College of Medicine showed that VR experience of the preoperative process could reduce preoperative anxiety and improve compliance during anesthetic induction in children undergoing elective surgery and general anesthesia.
Over the last decade, using different innovative technologies in healthcare has started directly affecting clinical practices too. And that brings us to our third poll question.
Okay, before we do this, just some comments, questions. I know, again, I can refer to Dan. We believe, Dan and I always say that virtual reality is still gamey and not helpful yet. It's like everyone uses it for training, and I want to use it for clinical care. I will say two things. There was a company called TeleView that I just saw. Mark Levitt told me about it. You wear glasses that look just like these, and the person watching can see what you're seeing and actually telestrate onto your thing. You can turn it on or off, telestrate while you're operating. The second thing that I think will be coming very soon is overlaying your CAT scans while you're operating. So if there's a tumor, you can see the anatomy if you turn it on or off. These are the applications that I think will become impactful. The final thing is you see these big goggles. I equate that to the big cell phones that came out that were this big, right? Justin, you probably still have one of those, but the rest of us have moved on. So I think, Apple's going to be coming out with glasses that are literally just glasses. And I think this concept of overlaying augmented reality will become more applicable for surgeons.
We can see the poll question.
Poll question.
This is another poll question, and we're asking, what is the best way to prepare for complex procedures? No offense, some of them are old kind of techniques, but would you rather watching technique videos, using hands-on training models, checking textbooks, asking an attending, which is no offense, rehearsing on patient's digital twin, or using VR to recreate the case, or all of the above?
Does everyone know what a digital twin is? Are you gonna tell them, or should we tell them now? All right. A digital twin is an actual digital replica of whatever it is you want. You could, right now, I think there's some app where you can scan your entire room and you can move furniture around, and that's a digital twin of your room. You can make a digital twin of a patient, and then you can manipulate the model. But a digital twin is you actually use a LiDAR scanner, and you can right now scan this bottle with the iPhone, and you will have an exact replica that you can play with and manipulate and see what things might look like as you adjust. So, all right. And people are using digital twinning hugely over the last 24 months in medicine. Okay.
Probably all over the place.
Is it all over the place?
Mostly watching technique videos or rehearsing on the digital twin.
Okay. Where do people get technique videos? Is it mostly YouTube? YouTube? Web search?
You should check Stake Your Nap.
Thank you. All right, let's play the video.
We live in a world that is changing very quickly every day. There's nothing wrong with watching technique videos or getting lost in the textbook chapters. But in the digital age, I think the best thing we can do as healthcare professionals is probably using technology for the advantage of the patient.
Today we have VR, digital twin, artificial intelligence technologies waiting for us to innovate how we take care of our patients. There are different companies like Induvo, which gives healthcare experts and educators a way to share their knowledge.
Induvo allows healthcare professionals to create a unique copy of their patient by using CT or MRI scans. Once the patient's digital twin is created, the surgeon can review it with a virtual headset before going into the case. The National Institute of Health, OSF Healthcare, and Children's Hospital of Illinois use Induvo for training surgical teams, evaluating patient cases, research collaborations, and much more.
On the other hand, Precision OS creates surgical simulations to accelerate skill acquisition or surgical readiness. It has established VR learning partnerships with about 29 medical institutions in North America, including University of Connecticut, University of Toronto, and University of British Columbia.
Unfortunately, a significant percentage of surgical residents report they do not feel ready to independently perform procedures upon completion of their training. So VR training represents an accessible, cost-effective, and deliberate practice methodology to help surgeons reach a competency threshold or achieve surgical mastery. Good news for the institutions who are interested in exploring what Precision OS can offer. Because the FDA approved Precision OS Envision as a VR preoperative planning tool. The patented software, to be available in early 2022, lets surgeons use an Oculus Quest 2 device to do preoperative planning.
But that doesn't mean it hasn't been used yet. You may have seen on the news a couple of weeks ago, surgeons used VR to separate twins with conjoined head in a 27-hour-long surgery. These surgeons spend hours of training using VR projection with Precision OS Envision and planned the operation while wearing an Oculus VR headset.
The surgery's direction depended on Great Ormond Street Hospital in London, while actual surgery was happening in Rio de Janeiro. This case is also a good example for telementoring, and one of the leaders in this field is Proximie. Proximie allows multiple people in remote locations to virtually interact in a way which mimics what they would experience if they were collaborating in the same operating room. Using artificial intelligence, machine learning, and augmented reality, clinicians can remotely interact in a live procedure or assessment from start to finish in a visually and intuitive way. It means they can physically show each other where to make an incision in real time or use physical gestures to illustrate a technique.
I think we are ready for our last one. What are we innovating this time? Do we want to go through a scenario?
Great idea. So Ramy, you're a surgeon in a pretty innovative hospital, and their goal is to make patient care better every day. You saw your patient a couple weeks ago, did the imaging, and used VR simulations for the pre-op planning, and your patient is admitted the day of the surgery.
You know that your hospital is trying to improve patient wristbands, which include patient health information, or in short, PHI, because especially for young patients like children and baby, wristbands can create problems.
Wristbands are difficult to fasten, may irritate the skin, and must be rotated in order to be scanned. Also, they can be tighter than it's supposed to be, which can hurt the patient, or too loose that you can lost.
We have a poll question here for you. Considering our problem, please choose if these wristbands can be innovated, and if so, how.
You can see the question. Any of the faculty here have any problems with patient wristbands, or did you ever experience this? So it turns out it's a very easy solution and it's very cost effective. But
What does the poll say?
I just pulled up a second.
Oh.
should we do fingerprint scan?
What does everyone think
should
here?
we use sticker patient ID, or should we tell our staff to fasten it better?
Sticker? Fingerprint?
Or just do it
Or
better?
be more careful.
Forget about wristbands. Why do we have so many stickers on patients? Why don't we have wireless EKGs and wireless pulse ox monitoring on babies in the NICU?
Great question. You end up walking out like a big sticky pad when you leave the hospital. Yeah. Okay.
I'll do research and let you know.
Yeah,
if
we'll
we-
get back
if
to you.
we-
All right. All right.
Fingerprints are winning.
Yeah.
Fingerprints is winning.
Fingerprints is winning, I think.
That should be
Yeah.
expensive.
Okay. All right, let's roll the video.
Again, there is no wrong choice here. All of these
Yes.
options are pretty doable, but every option comes with an advantage and disadvantage. And today we will talk about innovating patient wristband by replacing them with sticker patient IDs by a company called IDEO.
And the product that we're talking about today is their sticker patient ID called Identity Shield.
Is a smart ID sticker to replace the hospital wristband, and it is RFID enabled with an optical scanning option. RFID stands for radio frequency identification, and it uses electromagnetic fields to automatically identify and track tags attached to the object.
This sticker is made out of a very thin plastic material that's adhesive and non-reactive and hypoallergenic. It includes PHI, like the first and last name, date of birth, weight, blood type, or possible allergies, and lasts for 7 days on patients. The common use is NICU, newborns, and children due to the high loss rate of the wristbands, which is 12% in these populations.
The Northwell system, which is New York State's largest healthcare system, has used the badge on over 30,000 patients between October 2019 and November 2020, mostly at the Lenox Health Hospital in New York City during the pandemic.
According to the pilot study, patient, nurse, and clinical staff feedback was overwhelmingly positive, and 80% of the clinicians prefer the ID and Shield over traditional wristbands. And with the RFID layer, hospital staff can use NFC to read the badge without ever having to lift the patient's sleeve.
Let's not confuse it with the popular term NFTs. NFC stands for Near Field Communications, and it's a set of communication protocols that enables communication between two electronic devices. Unlike Wi-Fi or Bluetooth, NFC interaction is limited to an extremely short range, a distance of 4 centimeters or an inch and a half or less.
NFC has been a staple feature on smartphones for several years. The first Android device included NFC in 2010, and then Apple followed in 2014, which means NFC has been present since iPhone 6. So it's pretty easy to find devices to use NFC. In result, it's not surprising to see institutions like Children's Health in Dallas, Texas, are now using identity shields after Northwell Health.
We hope you liked our presentation, where we tried to include innovations affecting different areas of healthcare, from training to surgical planning to making patient care better.
Thank you for joining us today. Now we can have a couple questions before our session ends.
Yeah, Whit.
Quick question. I was intrigued by the digital twin. So how long does it take to create a digital twin for, prior to an operation? How much time do you need?
Yeah.
So we talked with Dr. Bramlett. He has a lab in University of Illinois, and they've been doing it for regular cases, for pediatric cardiology cases. He said it's gonna take a couple hours if it's emergency, but and the surgical oncology cases they started doing, it's gonna take a couple days, but not more than that. And also they have a free submission form that you can we can email whoever interested in, and they can create the digital twin for your patient just to use for the case, and they email you for free. So if you have any VR headset that you can use and practice.
Yeah, and I'll say that these sim centers that are popping up over the country are changing and becoming more involved in this type of thing. I was at Nebraska about a couple months ago, and they were making digital twins with everything. And I asked them, can we work together to make a digital twin for an inguinal hernia model, a digital twin for, what was the other one we were going to do? Hernia, and then there was maybe colorectal model or something.
Malrotation.
Malrotation, to be able to understand and teach and look at it. They said it should take us no time at all. It's that fast. And it absolutely blew my mind. I have to tell you, this is up and coming. Oh, sorry.
Todd, what has been the hurdle of this becoming a reality more quickly? Just 15 years ago, Rick Satava stood up at SAGES and talked about the patient walking in the hospital, getting a scan, like a CT scan as they checked in, or a regular CT scan, and then you took that three-dimensional image as the surgeon the day before surgery, and you practiced the operation on your brand new robot, and then when you finally got it right, you hit save. Then the next day the patient goes to sleep, you dock the robot, and you hit go. Yeah. And you sit there and just watch the operation. So, but that's 15 years old. And so what's been the hurdle?
Well, first of all, progression is exponential. So 15 years ago, it would take 15 years to go from science fiction idea to reality. Now we're seeing it in months. And so now that we're on this upslope curve, the fact that it's happening now, that many hospitals already have LiDAR scanning, I think that we'll find in probably 2 years, most of the hospitals here will have some version of this at their fingertips. I just want to take 2 seconds to point out M. I met M on an app called Clubhouse, which I don't know if you know what that is. It's like you have these meeting forums to talk about. We did a medical clubhouse. I met M. She blew my mind. I asked her if she would come and be our fellow. Dan has entrusted in me to allow to have a completely virtual lab. Our lab's been virtual forever. So we had M starting off in Turkey. We've got Ramy in Egypt, and we've got Brittany in Kentucky, and Ellen in Akron, and we're all over the place. And so I think that we can make real progress. I just want to say that I thought this was a phenomenal presentation. And I want to congratulate, which was a just recent medical student grad, that this was phenomenal. Thank you. Nice job. This was great. Break. Quick break, turn around so we can put the new faculty up, and we're going to come back and talk about who you can send home from the emergency department.